হ্যালো এভরিওয়ান, নমস্কার। আমি ডক্টর অদিতি বন্দ্যোপাধ্যায়, অনারারি ম্যানেজিং ট্রাস্টি অ্যান্ড ফাউন্ডার ট্রাস্টি অফ সাম্য ফাউন্ডেশন ফর স্পেশাল নিডস। আর আজকে আমি আপনাদেরকে কথা দিয়েছি যে আই উইল কাম অন ফেসবুক লাইভ। সো মাই কানেক্টিভিটি ইজ অল রাইট। আমার কথা শোনা যাচ্ছে কিনা কাইন্ডলি লেট মি নো। একটা মেসেজ করলে পরে সুবিধা হয়, নইলে তো বোঝা যায় না। সো প্লিজ লেট মি নো দ্যাট ইফ ইট ইজ। থ্যাংক ইউ অনুপ্রিয়া ম্যাম যে আমার কথাটা শোনা যাচ্ছে। থ্যাংক ইউ পাপড়ি ম্যাম, শোনা যাচ্ছে। বহুদিন ধরে আমাকে ওকে, আইল কিপ মাই ডিসকাশন ইন ইংলিশ। থ্যাংক ইউ সো মাচ ফর গিভিং মি দ্য ফিডব্যাক। নাও লেট মি অলসো টেল ইউ দ্যাট thanks Shomi ma'am, thanks to everyone. Now the thing is that many of you keep asking me, and I will keep my discussion in English and Bengali combined because this is a universal topic, and I know that some of you would like to hear me who are not conversant in Bengali. So I will try to keep the essence of the talk alive in English as well as in Bengali. Thank you. Some of you who know me, you know that I have been working in the field of autism as a parent, as a parent advocate, as a dance and movement therapy practitioner, someone who has modified the psychotherapeutic model of dance movement therapy and implemented it as Samya model of dance movement therapy, which runs as a course through Samya Foundation and Jadavpur University Department of Education. Besides, I am an assistant professor of physiology under West Bengal University of Health Sciences, presently posted in Sharat Chandra Government Medical College at Uluberia. So for a long time I have been working, and we have one community clinic at Samya Foundation, which is a free community clinic, and I get to see every week a lot of children and adults coming with autism. এই এতগুলো কথা বলার একটা উদ্দেশ্য যে যখনই মা বাবারা, আজকাল দেখি ট্রেন্ডটা ভীষণ বেশি, অভিভাবকেরা, পেরেন্টস কামিং টু মি or parents calling me that ma'am, we want to meet you, we want to talk to you, we want to talk about my child. They say, and mostly for newly diagnosed children, they say amar cheler ba amar meyer, my child has mild autism. The word mild is said so mildly because they want to prove the intensity of the mildness. So they say they have mild autism. So, and we all know, according to DSM-5, Diagnostic and Statistical Manual 5, now everything is under autism spectrum disorder. So Asperger's syndrome as per se is not there according to DSM, but International Classification of Diseases has Asperger's syndrome, the word for mild autism. So some will say, oh, my child is an Aspi, and they'll be very happy about it. Of course, you must be happy if your child is on the milder end of the spectrum, which means probably less challenges. And the word mild makes you understand যে এই তো অটিজম থেকে বেরিয়ে এলো, আর বেশি অটিজমটা নেই, একটুখানি ছিল বর্ডার লাইন, জাস্ট একটুখানি হেল্প, একটু স্পিচ থেরাপি, একটু and after একটু my child will come out of the autism, and then I will not even think of the word autism, because that is what people do tell them also. So they come with a lot of expectation that my child has mild autism. Now, to tell you the truth, I am the mother of one such mildly autistic child whose issues are huge, and I am sure there are many here today watching me. They know that mild autism is still autism, and autism being a disconnectivity pattern of the brain where the wiring of the brain is completely different. ব্রেনটা একটু অন্যরকম ভাবে চলে, নার্ভাস সিস্টেমটা একটু অন্যরকম ভাবে অ্যালাইন। তার মানে যে তার অন্যান্য ইস্যুস অফ অটিজম নেই তা না। সে কথা বলছে মানেই যে সবসময় রেলিভেন্ট কথা বলছে, irrelevant কথা বলছে না or answer properly করছে বা comprehend করছে টেক্সটকে properly, is reading the text properly, not that. We know that mildly autistics have huge problems. So I wanted to discuss some of them because I know some of you have always asked me, ma'am, please discuss about adolescence. Please discuss about mild autism. Again, to tell you the truth, autism is a spectrum which belongs to mild, moderate and severe. And moderate to severe grades are mostly based on the classifications based on different types of assessment tools, CARS 2, ISA, etc. We see mostly who are non-verbal, they go towards moderate or severe according to the scores. But again, there is a word, non-talking autism is not non-thinking autism, and it has been proved. I am going by those proofs where I have really seen them working and thinking a lot, though not being able to express. But today I will talk only about those who are being able to express but unable to handle their huge sensory issues, unable to handle their huge anxiety issues. Now I will come to a short story, খুব ছোট্ট story, and most of it I will relate to about my own experiences with my son. It is just a few days back this has happened. I wanted to share it. My son he's an adolescent. He is 16 plus. Naturally, this age is such an age, আমরা সবাই দেখেছি আমাদের এই বয়সে একটা fan following, hero worshipping that happens. বাড়িতে কাউকে একটা দিদি, দাদা, মামা, কাকা, uncle, aunt, কাউকে খুব ভালো লাগে, খুব ভালো লাগে. And naturally that person হয়তো এত সুন্দর করে কথা বলে, caters to my thoughts, answers my questions, is patient with me all the time, that somehow I feel this person loves me a lot. Someone who is out of the family, may be a relative, may not be a relative, may be a friend, may not be a friend, but loves me, likes me. It happens to boys and girls both, and it does not always have that, always this fascination, infatuation, obsession has to be towards an opposite gender. সবসময় যে অন্য জেন্ডারের প্রতি হতে হবে তা নয়, সেম জেন্ডারের প্রতিও হতে পারে. For confidentiality issues, I am keeping the names and changing the names. So let's say my son had one such hero worshipping for one of his Mesho Moshai uncle, that is my cousin sister's husband, whom he likes a lot. And let's take his name to be Mr. Borun Bhattacharya or Dr. Borun Bhattacharya. ওনার নাম কিন্তু বরুণ ভট্টাচার্য নয়. So my son likes him so much, but I know, in spite of being a very busy person who is always very affectionate towards my son, many a times have attended to his phone calls, but it is really disturbing for him if my son keeps calling him all the time. So I have structured this time when you can call him, and he knows that when you need to call somebody, you need to ask a question over WhatsApp. May I call you now? But he refrains from doing so, because at the time when he wants to talk to that person, his urge of talking is so much that it overpowers his the way he's structured, that you must ask a question. And that happens to all of us. When we love somebody dearly, we want to talk to that person at that time. So he has been doing that for quite some time, and he does it with his friends. Now let me tell you this, I get, and those who are here in the field, I see a lot of psychologists and special educators joining. We know we get such phone calls from many such autistic youths, adults, adolescents all the time, even from other countries. And they say, auntie, ma'am, I want to talk to you right now. And there are times when I am busy too, and I tell them, can we talk a little later? এখন তো পারবো না, কালকে কথা বলি, or এই Saturday 7 PM এ কথা বলি. They want a finite answer. Many a times I am not able to take the call even. Rather, I send them a voice message and I tell them, I know I have missed your call, but I will talk to you on such and such date, maybe after 2 weeks. But do call me then and ask me if can I talk to you. But all they want is a little attention, a little love, a little care, and the assurance that yes, I am there for you. So anyway, this uncle of my child, my own relative, perhaps he got bothered by his repeated phone calls, and he stopped answering his phone calls very recently. So I did communicate with my cousin as well, his wife, and ask her that, I know it's a botheration for you all, but and I'm telling this to you, this is not only against anyone, but this happens a lot to our children. যে তোমাদেরকে ডিস্টার্ব করতে চাই না, কিন্তু একটু যদি ওকে টাইমটা বলে দেওয়া হয় ও কখন কল করতে পারে তাহলে খুব ভালো হয়. My son kept waiting for that phone call yesterday throughout the day because he knew that because I had received a message that he would call yesterday and it was a national holiday yesterday. He kept waiting till night. And when the phone call finally didn't come and his repeated phone calls were unanswered, my messages were unanswered, then somewhere his heart broke. Now we all have such heartbreaks. There is nothing great about it, right? Or nothing to be totally heartbroken about it. But remember, this person has autism. This person has huge anxiety issues. This person, in spite of all the necessary therapies, counseling, special education, is still an autistic person. And as I said, mild is not mild because we deal. Here Nilanjana Ghosh is there with me. She's Shibani Bishya. I'm just mentioning few whom I can see. They are all mothers of adults, autistic adults, and eminent special educators in the field. I'm sure they will agree with us that adults and adolescents, even though autistic, they have the same kind of feeling as we, the so-called typicals, have. The atypicals do have it, but their manifestation of expression is very different. When anxiety piles up, then they cannot handle it. And that is what happened to my son yesterday night. He had a severe meltdown. He could not handle himself, and so much so I was so touched as a mother that he started crying. He was roaming around and crying, and when I said don't cry, he said na ma chokhe batha korche, my eyes are aching, I am not crying. So I realized how my child has grown up. He has started realizing I cannot even say that I'm crying for this reason. But then started the neurological issues that piles up along with that. Shaking of the limbs. Kind of a mother who gets shaken with the idea that this might trigger a convulsion. I sent repeated voice messages. We all tried from our end, and of course for obvious reasons our relative could not respond. And finally, I refrained from the idea because every time he has a panic attack, I really cannot overdose him on medications. No mother wants to do that, no doctor wants to do that. So it was a lot of effort, and I did tell him that about so many people who like him, এবার আপনারা বলুন, আমরা যখন কাউকে ভালোবাসি না, আর সে যখন আমাদেরকে মনের দুঃখ দিয়ে সরে যায়, no matter পৃথিবীতে 100টা লোক, 100 people might come and tell you, oh no, I love you so much. Why don't you realize that I love you so much? What is there in that person who does not love you? Why don't you understand? But truly what happens to this person, কি আমি একজনকে এত ট্রাস্ট করেছি, আমি একজনকে এত ভালোবেসেছি. Yes, Nilanjana, Shuchishmita Di, what you are saying is Nilanjana, that they get into severe depression. They feel so shattered and broken. So what happens, we all start feeling যে আমি যা ভেবেছিলাম তুমি তা নও. They feel cheated, they feel hurt. Now I am not directing this to that person, I am directing this to the society, because now we are talking about inclusion, right? This happens not only in case of a relative, this happens with school teachers, this happens with counselors, this happens with parents. I get so many phone calls from autistic adults, and I have been asked by so many other parents, ওর ফোনে না বেশি উত্তর দেবেন না, কিন্তু ছেলেটা তো বড় হচ্ছে, তো বুঝতে পারছেন মেল পার্সন, একটু ফিমেলদের প্রতি অ্যাট্রাকশন তো আছেই, বেটার নট টক টু হিম মাচ. অ্যান্ড আই সেড, কাম অন, হি ইজ লাইক মাই সান, হি ইজ লাইক মাই ব্রাদার, অ্যান্ড আই নো ওয়্যার টু ড্র দ্য লাইন, বাট আই ক্যানট ড্র আ লাইন ইন আ ওয়ে দ্যাট উইল হার্ট হিম মেন্টালি. I need to talk to my child, I need to talk to this person. And how much does it take? Because people who are autistic, they have a very pure mind, they are very receptive, they are very innocent. So what happens, you just take a phone, drop a voice message, I am busy right now and I can't talk to you, I'm so sorry, we'll talk later, maybe that date, that time, because they want a finite answer. We all need a finite answer, but sometimes we the typicals sometimes feel যে ঠিক আছে পরে মানে পরে, হোয়াট পরে, কত পরে, কত দিন পরে, কত ঘন্টা পরে. that becomes very difficult for an autistic person. Mostly mild autism কেন বলছি, because এদেরকে দেখে মনে হয় একদম ঠিক আছে. Here Boishali Dhar Basu is commenting that my daughter faces it so many times because they want to talk, and you understand friends don't talk to him, because if someone goes and talks to the person only about lights, switches, fans, maybe color of hair, maybe size of spectacles, I know those topics are sometimes very boring to you. They keep on asking you about life and death. Why does some humans live after till 80 or 100 years? Why not 700 years? Why do tortoises live till to 700 years? Why can't a human live to 700 years? And mostly so, interested only in the question, not in the answer. I am telling you, yes, mild autistics do that. And even those who are on the moderate and severe end of the spectrum, they are not being able to ask you the question. But they have the same kind of question. That is due to a kind of anxiety, a fear of losing my new own ones. So I have my trust on somebody যাকে আমি প্রশ্নগুলো করতে পারি. I get so many phone calls. People, they call from other countries and states and they tell me, auntie, I liked a girl in my college, but she doesn't like to talk to me. And then I said that, talking to you is a choice, right? They want to talk to you, it's a choice. You have to understand, friendship is also a choice. But then at the same time, if I tell them, someone made a wrong choice like this, talking to somebody over Facebook, and it turned out that person was someone else. And immediately her reply was, someone was talking over Facebook. Please tell me whom. I want to talk because I want a friend. Your heart breaks. Your heart breaks to hear that. So let me tell you, mild is not that mild. When this anxiety can precipitate a convulsion, this anxiety can precipitate a depression, and this anxiety can culminate into, God forbid, a suicide. It happens. I know someone, an adult, who succumbed to it and did that. Because it hurts very much within. I am keeping my door closed while I am talking to you about it. Now let me go to the other side of it. Yes, Nilanjana, please keep commenting, because your comments, your feedbacks is important. I do not get to see that all the time, where Nilanjana is writing that this is also a kind of bullying. Maybe someone is not doing it intentionally, but it hurts. So parents who are raising their children with the thought, আরে আমার বাচ্চা তো মেইন স্ট্রিম স্কুলে পড়ে, আমার বাচ্চা তো সব গড়গড় করে মুখস্থ কবিতা বলে, আমার বাচ্চা অ্যাডিশন সাবট্রাকশন ডিভিশন সব পরপর করে ফেলে, নো ইস্যুস উইথ মাই চাইল্ড, ওদের তো সিভিয়ার and moderate, we feel sad. And honestly, there is another side of the mirror. Those parents whose children are on the moderate and severe side, they feel very hurt, but at the same time they also think, খুব তো বলছে এখন মাইল্ড, দেখবো কতদূর যায়, এই তো 16-17 ইয়ার্সে গিয়ে শাটডাউন হবে, তখন ঠিক আসতে হবে আমাদের এগুলোর সাথে. Both are equally hurtful thoughts. Both are. Because you are not thinking of these children together as your own child. And if we do so, we are all going to land in a very, very big soup. Let me tell you that. We have to make the society aware, we have to make teachers aware, and we have to make relatives, we have to make their working places sensitive about these issues, because this can culminate into a very big mental health issue. Now we will say that, take your child for counseling. With due respect to all the psychologists playing a big role in the society, all the therapists, sometimes non-parent therapists and psychologists playing big role in the society. I have had a very good experience with all of them, but I am telling you, with most of them, I don't know all of them, but let me tell you, they first say, মাটা বরবর করছে তো ফেসবুকে, maternal depression, mother has a burnout, mother has to be treated. Please, sir, ma'am, we are more resilient than you think we are. We are more stronger than you think we are. We are concerned about the mental health of our child. Please help in doing that. Priti, you're writing, Vishwanath feels nice if someone talks to him and feels ignored. And yes, and I know, Vishwanath is not able to verbally express. May I take your permission in saying that? But they feel very, very hurt. And this hurt is so much that it really makes them feel that we don't want to continue further. Because this is an age where you start realizing যে মা তো আছে, দাদু দিদা তো আছে, হয়তো বাড়িতে বাবা তো আছে, এরা তো আছে আমার সাথে, but এ কেন আমার সাথে নেই, আমি যে বড় ভালোবেসেছিলাম। টু অ্যান এক্সটেন্ট ডক্টর বরুণ ভট্টাচার্য, মাই son had so much love for him that he started looking for Borun Chando over the internet. Because that name বরুণ, নাম মাহাত্ম্যর মতন, মানে কৃষ্ণ নামে যেমন অনেকে শ্রীকৃষ্ণ নামে কৃষ্ণের ভাব উদয় হয়, আমি কিন্তু ভীষণ বিশ্বাসী ঈশ্বরে, কিন্তু ঠিক দ্যাট কাইন্ড অফ ফিলিং কামস আপ। Then they frantically start looking for, that name, Borun. And he did that. Borun Chando in Satyajit Ray movies, Borun Chando doing his adventures everywhere, and he's looking through it. Because the name matches with his favorite person. Can you imagine the amount of hurt this person goes through? Now let me come to another story. I'm telling you not the stories from my end because I don't want to give any kind of instructional idea through this. I want to come and talk to you and share about this very often because I think this is the place where we are not aiming at. We are thinking of livelihood programs. Here is Dr. Sudeshna Chaudhary here. She's saying so very true because I know Sudeshna is doing a wonderful job. Not only setting up a livelihood program at Ananda Ashram, but at the same time she is looking after the mental health of the residents there. Onju ma'am is here. Her daughter is an adolescent teen on the mild end of the spectrum. Pammi ma'am is here. Her son has the same feeling. So you can read their comments while I keep on talking to you. Now this happened to again my child a few days back. Somehow he was not well and he chose to take the elevator to go up to his classroom. I got into the elevator with him as well. Another girl got into the elevator with him as well. Now let's take the name of this girl is Malti, though her name was not that. And my son said, Malati, hello. You and Ravina are very good friends, right? You are the best of friends. And she said, no, we are not the best of friends. And this was a story that lasted from the ground floor till the second floor. এক তলা থেকে তিন তলার মধ্যে গল্প শেষ। No, you all both are very good friends, I know. Because you chose to stay back at class 9 together. Why didn't you go to class 10? At that moment I felt so embarrassed. আমাদের বাংলা একটা কথা আছে, ধরনী দ্বিধা হও। I just felt let the ground below my feet go apart and let me go get into that because I realized maybe she was repeating a class and he was very much curious to know why are both of them repeating that class and why both of them are together, so that means they are two good friends. So she said, no, Ravina is not my very good friend. He again asked the question. No, my question is why both of you wanted to continue with class 9 and not go to class 10? Because you are good friends. And then I said, well, Ishan, she's a very good girl and they want to study class 9 really well. So made a choice. No, must stop. Let her answer. Please tell me why? Tumra keno? Why didn't you go to class 10? Because all other friends went there. You are two good friends. That's why you stayed back in class 9. Now what do you do about this situation? This girl would definitely feel very insulted and repelled, and next time maybe won't talk to him. Sensitization is required at such a level. But this boy, maybe my son in this case, will face a severe repulsion because he doesn't know. So we have to educate our children also. I talked to him after that about why people repeat classes, why sometimes they don't qualify and they need to read it really well. Maybe he might need to do it at some point of time or the other. But by that time, the damage in that relationship with a friend is already done. Mo says, সব থেকে বেশি অসুবিধা হয় mainstream স্কুলে because বাচ্চাদের অসুবিধা ফেস করে and nobody tries to guide them. Now I'm coming on the role of teachers. Now what do we do about in this case? The parent, that's me, should immediately report it to the class teachers, special educators, if they have the time, to bring both the children together or maybe counsel both separately and bring them to a point where the trust issue is not lost. Because this girl might feel so insulted because she's also at his age. She is not a matured adult. And that is the reason you will see mild autism. We say mild autism. This is not so mild. It has got grave issues underlying. We see only the tip of the iceberg. আমরা ওপর থেকে দেখে ভাবছি আরে বাবা কি ভালো অঙ্ক করে দেয়, ইস আমারটা যদি পারতো। জানি বড় কষ্ট হয়, কিন্তু একে দেখে যে এটা বোঝা যাচ্ছে না যে বাইরে রাস্তার লোক বলে আরে ওই পাগলটা বুঝলি না, হ্যাবলা ক্যাবলা কথা বলে সব সময়, ও কোনো মাথা মুন্ডু নেই, ওর মা পেছন পেছন দৌড়োয় ওর সারা জীবন, কে দেখবে ওকে সারা জীবন। অ্যান্ড হোয়াট টু দিস প্যারেন্টসে, হ্যাঁ হ্যাঁ খুব তো গেছিল মেন স্ট্রিম স্কুলে পড়তে। আমি এটা ফেস করেছি, আই হ্যাভ ফেসড ইট অ্যান্ড আই নো হাউ হার্টফুল দিস ইজ, বাট স্টিল উই উইল কিপ ট্রাইং এজ প্যারেন্টস। এবার মেন স্ট্রিম স্কুলে আসছি। মেন স্ট্রিম স্কুলস, দে হ্যাভ গ্রেট effort, they make a lot of effort in implementing special educators, psychologists, counselors, but they are never able to meet up the standard set by the mainstream boards. Mainstream board কি বলে 1:11 বাচ্চা রাখুন, অসম্ভব। স্টেট বোর্ডে একজন কাউন্সিলর এক একটা মাসে এক একটা স্কুলে যায়। CBSE board schools, one special educator is to 50 children perhaps. That is the truth. Because it is difficult, even if the principal or the higher authorities have the intention, sometimes school boards, it takes a lot of permission to go through that to hire enough number of special educators. In spite of that, several schools do have it. But is it possible for a teacher in nursery to teach someone in class 12? Or is it possible, I'm not questioning the educational ability or qualification of that person. Is it possible for a teacher of class 12 to come and teach a student of kindergarten? Is it possible? It is never possible. But that is what happens, and that to special education, where you need to guide them in every subject. It is never ever possible. So what happens, I'm relating to some of the examples. What happens is, I've written it down. A special educator newly appointed by school, let me not talk about my son, let me tell you, tells this child of class 10 in special education in one reputed school of Kolkata, and says that during maths examination, and this child has an adult prompter, a mother sitting by the side, and the special educator says, read your question paper well, you have been taught to do so. And the mother says, ma'am, please excuse him from reading the entire question paper all over again, because ও যদি পুরো কোয়েশ্চেন পেপারটা না এখন পরে ও অ্যাংজাইটিতে পুরোটা আনসার করতে পারবেন। If my child goes through the question paper totally, he will not be able to answer it. Now let me tell you something. Question paper in class 2, addition, subtraction, division, problem sum, over. So the one who is directing the child knows that this child is good at maybe division. So do division earlier, do multiplication later, do addition later, do the problem sum later. That is how our brain maps it. When we go to higher classes as typicals, I am telling, okay? When typicals go to higher classes, what do? আমরা একটা question paper কে overall দেখি. We do not go by the math, quadratic equation one by one. আচ্ছা, একটা quadratic equation later on. Arithmetic progression, okay, I'll do it now. Trigonometry, maybe we'll attempt it first. A problem later. সেটা আমি আপনি পারি, but someone with autism who's a detailed thinker and is going by every line in a detailed way. Yes, Nilanjana, I see, yes, how people label them, I have seen it now. I'm not being able to concentrate on the feedbacks, but thank you for giving the feedbacks. Now what happens is, now this child is trained, attempt one question, because CBSE has almost 50 questions in a maths question paper, and first 20 have only 1 mark with a lot of calculations. Next set of 10 have 2 marks. Next set has 3 marks. But there are so many, and even state boards have that. Now if I tell you, and ওই অঙ্কটা দেখে তো বোঝা যাবে না, অঙ্কটা দেখে কি বোঝা যায়? Is it like a question of history? Okay, let me attempt this later, let me attempt this first. But this special educator keeps telling, it's a good habit to read the question paper fully and then answer the question. And the adult prompter who is guiding the child in terms of comprehending the questions as per CBSE form says, ma'am, the child has been taught to go attempt each question. If he cannot, go to the next one. Otherwise, this child will get lost among the questions. It is not a question paper of English where you have section of comprehension, section of writing skills, a section of literature questions, a set of grammar, where you can say grammar age korbe na literature age korbe. Okay, grammar, do it. It is not that. It's a maths question paper. Mind it. Now, how can special educators also with so much of knowledge not realize that at every point you have to guide the child in a customized and unique approach? And please rely on the parent. my minati to the society, my minati to the therapists and psychologists here now, as a mother and then also as a professional. Don't think parents know too much. Yes, they know too much. Please accept it. Because the parent is spending time with this child 24/7. And if you really want to help the child like the way this parent is helping the child, take the child to your home. It is easier to say standing at the corridor and the staircase. I'm not telling this from my experience. I'm telling this from the experience of another parent in another school. It is very easy to say, বাচ্চাকে না বোঝাবেন, প্লিজ মেক হিম আন্ডারস্ট্যান্ড নট টু টেক দ্য টেনশন অফ এক্সামস। বোঝালেই যদি এত বুঝতো তাহলে কি এত কিছু করতে হতো ছোটবেলা থেকে? If explaining was so easy, then would we have gone through special education, counseling, therapies to control and make the child sit at one place, handle the anxiety, go through multiple kind of interventions? So my request to therapists is, yes, empathize with the parent, but don't make the parents understand, oh, you don't know much, I know everything. We all know very less. Please accept the fact. We as parents, special educators, psychologists, therapists, doctors, autism is a big mystery till now. And if you have seen, according to Dr. Stephen Shore, if you have seen one person with autism, you have seen only one person with autism. Do not generalize, please. Do not generalize, please. হ্যাঁ, আমি তো দেখেছি একজনকে এরকম করতে, ওই বাচ্চাটার মাটারই মাথাটা খারাপ, উফ বাপ রে বাপ, কি কথা বলি যেরকম আমি বলছি। Because your one word, your one ignoring to this man, you are being indifferent to this person will affect this person so much that you do not know. But you have to take the responsibility of that, of such words. Yeah, Anju Das says, I have to keep working on mine so that the child does not slip to moderate. People think visually to kono problem nahi. Yes. So, yes, Anushka, you being a psychologist, you're saying that parents are the best therapists. Not always. I'm telling you, not always. Parents have a lot of denial. Parents come with a lot of, complacence and other things. I have to deal with that. But when I work as a therapist, I know I have to trust the parent. If the parent is saying, আমার বাচ্চার এটা খেলে অসুবিধা হয়, আমরা ট্রাস্ট করি যেরকম, ঠিক সেরকম ভাবে প্যারেন্ট যদি বলে যে আমার বাচ্চাকে ইগনোর করলে ওর কষ্ট হয়, আপনি প্লিজ ওর সাথে এখন ফোনে কথা বলবেন না, কারণ আজকে আপনি কথা বলছেন, 3 দিন পর আপনি কথা বলবেন না, তখন কিন্তু ওর কষ্ট হবে, ওর বড় কষ্ট হবে, যেটা আমি চোখে দেখতে পাবো না, ও ফিল করতে পারবে না, আপনার এতটুকু আসবে যাবে না। বা আপনি এমন কথা ওকে বলছেন যেটার জন্য ওর অ্যাংজাইটি বা ডিপ্রেশন এমন এসকেলেট করে যাবে, যেটাতে আমি বা ও, আজকে সকালেই দেখলাম someone has said that, how come a mother herself, she is so frustrated and she is so sad and depressed, saying that a mother came to her, and she's also a doctor. She said mother came to her and said, I want my 12-year-old to die. And we all said, so much is the frustration and depression at certain extent that sometimes people do say such words. Now please, my request to psychologists, you all are very good supporters for us, but never say that this parent is so depressed, baba tar theke to bachchari bhoy ache. No mother will do this to her child, mostly. Thank you, Suja. Yes, you are saying that, and that's the reason I'm also communicating in English, because you are seeing this from Bangalore. I want to reach out to parents, and I want to reach out to therapists and special educators with this too. Parents do understand their child. Parents, after 5 or 6 years of their age, they know this is my life. They are not depressed. They just want you to help out to reach my child's mind. Don't say, আপনারই না খুব দরকার, সিনেমা দেখে আসুন, একটু বরের হাতে হাত রেখে একটা সিনেমা দেখুন, কতদিন তো নিজেরা একসাথে সিনেমা দেখেননি। We know what we need. But more than that, what we need is absolutely my child to feel happy and good. We know happy mothers make happy children. But a mother is also not happy seeing the child sad. Nilanjana, you're reading যে অনেক মায়েরা বড় কষ্টে কথা বলে। Exactly so. yesterday this feeling I felt that parents have been telling me so many times, but I don't talk about adolescents and adults because I am myself learning, struggling with it each day. Now let me talk to you again about another child. Okay, last but not the least, I'll talk about this child because last time I explained about this child in another school. This again happened to another child in a school. Shucharita ma'am, yes, I feel sad when my child is ignored. Yes, absolutely. And there are instances that happens. বাচ্চা বেশি আওয়াজ করছে, বাড়ির লোক একটু অন্যরকম তাকাচ্ছে, মাকে বোঝাচ্ছে। Trust me, বাচ্চা আওয়াজ করলে আপনার যত খারাপ লাগে, before that we feel more embarrassed and we move out from that situation. You don't have to make us feel that, right? No matter how much on Facebook we keep rebelling and saying that accept my child, but we know when my child is behaving in a socially inappropriate way, we are more embarrassed than you are. And we know where to draw the line. So now let me next come to another point regarding exams, CBSE exam. I saw the question paper, one very reputed school in Kolkata, regarding arithmetic progression, where some students got marks. This is about another school, not talking about my son's school. Please don't, because since I am talking, people might think so. But the question, CBSE has every last question on mathematics based on a picture. Ekta chobi thakbe, chobi ke kendra kore. Now that picture said in a classroom, maybe Anita scored this much, Rajesh scored this much, and their scores to be set in arithmetic progression. But the picture had only faces of 5-6 happy children. Now, my question is, the mandate of CBSE is to make the problem based on the diagram or the diagram based on the problem? Tell me. Definitely the problem based on the diagram. So the diagram, if it has a picture of happy faces, how will we understand? We will not be able to understand, but we know the answer to comprehend the question, to comprehend the question. But this boy, a detailed thinker, or a girl, a detailed thinker, autistic, they will immediately, and not even, that does not require mildly autistic to be do so, even moderately or severe, whom you call as moderate and severe, they may be mild on the spectrum, they will find out that where is the problem, because they are the detailed thinker. So CBSE has given an excellent provision of an adult prompter to sit next to the child to help the child navigate through the paper by comprehending the questions. A scribe in state boards writes answers for some of them who require it. But my point is, why do they need this help? Because maybe they are brilliant in calculation. They see one equation and immediately can tell you the value of x. But how to frame that equation from the problem, that is a problem. Because by the time they read the entire problem from the first word till the last word, they are lost. যার এতটা নিজের কথা বোঝাতে অসুবিধা হয়, যে নিজেকে বোঝাতে পারে না, the person who is unable to express his mind, how do you think that person will read your mind? Yes, Preeti, you says that it is very true, we never make our child embarrass others. Yes. And Nilanjana says inclusion একটা advertisement হয়ে গেছে. Yes, I understand that. So I'm telling you about the story of another child, because many of you know that I do peer sessions. In my peer sessions, my brilliant children, all adolescents, my 3 girls, 3 boys, 1 boy is yet to join. They come, they talk about their own topics. Someone talks about train, someone talks about movies, someone thinks about lights and switches, someone talks about higher philosophies, someone thinks when to go home. They all have their different topics to talk about and think about. And that is the amazing part of autism. When you sit among them, there's a galaxy of thoughts around you. People are talking about different issues. Whatever excites them, makes them happy, they talk. But somewhere there is a connection. And that connection needs to be figured out by us. I'm sure many psychologists and special educators are excellent at doing that. But there is one boy who every time sees a movie comes and says, আমি ওই গল্পটা বলবো, I want to tell you the story of that movie. And we all keep waiting. Just tell us the name of the story of the movie. Then the thought process gets blocked. He says, I have seen this movie, say, what is it? Bahubali. And then the man comes. Then another lion comes. a big castle. What is happening? The autistic brain maps or takes them or registers them in the memory as snapshots. When we talk about a story, how do we talk? Think about the story Barfi. So many parallel things taking place together, right? So we are telling them, this was happening. Barfi had someone who has seen Barfi had an affair with a girl whom he liked, and at that time again they are going back to a story or going front. So the stories are all parallel in movies, right? একটা এখানে ভালোবাসা ঘটছে, এখানে ভায়োলেন্স ঘটছে, এখানে পূর্বজন্ম ঘটছে, এখানে আফটার জন্ম ঘটছে, কিছু কিছু সব ঘটছে, they come together. A movie is not a novel. What happens, or a short story, what happens for autistic individuals, they register everything like snapshots of memory, snapshots in their memory. But when they are going to connect them sequentially, it becomes a big problem. Then they think where to start, where to end, and I tell them, let's make points. Okay, this has happened, let's keep it. Next, this has happened, okay, let's keep it. Now you tell me, mild autistic, syllabus is huge. So many stories to remember. I'm not again telling you mainstream boards, even in NIUS. Even those who have been trying to do such things, not even in academics, maybe in functional academics, not in like mainstream academics, maybe not in functional academics, in vocational. They need things to be broken up for them. I know I'm not requesting the society to make it conducive for them. I'm not asking psychologists to spend days with them and take them home or adopt them. I'm not asking special educators to, come home to every child and be with them and give their parents a respite. Yes, here Mr. Aditi Bandyopadhyay writes, grandfather of someone on the spectrum, my father, he says, how the child can be pacified who is hurt, feeling ignored by a person so dear to him. Yes, I'm coming back to winding it up. So, I'm telling you, there are certain methods parents do adopt. And from parental experience, I'm telling you, everything does not go by the book. So again, coming back to what I had experienced yesterday with my son. Last night, I kept on telling him that, there are so many people to love you. No male person. And I'm a single mother. So he feels that he has been rejected by the male community. No matter he has an excellent grandfather by his side, his maternal uncles, he has our family friends, our relatives, everyone ready to help him. But this repulsion from a dear uncle whom he considered to be his hero made him so utterly sad and depressed. So I kept on telling him that there are so many people to love you. Like it happens now, I have a great fan following for somebody. And suddenly I feel that this person is no more. This person will never talk to me anymore. আমাদের ছোটবেলায় হতো, I'm telling you, when we were kids, we used to see Ramayana and Mahabharata. Every mother would agree with me here, or every woman or men, because we used to see Ramayana and Mahabharata. The day we realized that there is going to be no more Mahabharata, all the episodes are over, I cried and cried for the role of Arjun. I cried and cried for Lakshman when Ramayana ended, because I liked them somehow. I would never see them talk again, though they never talked to me ever. This happens at this age, where they have this fan following. And when it happens with a relation or a friend, then they feel, আমার সাথে আর কথা বলবে না, এর সাথে আমি আর কোনোদিন রিচ করতে পারবো না. So this morning, I had to take a different stand, which is quite contrary to what special educators or psychologists or all the theories would say. I finally told him, this uncle mailed me. And he said, I'm so eager to talk to him, but I can't help. My phones are not working, and I am on a month's vacation to some place to work from where I won't be able to make phone calls. Now you lied to your child? We've never lied to children with autism. You made something his expectation will increase. Why did you do so in the first place? Let him cry, let him have a meltdown, let him bang his head. In the matter of fact, he banged his head also yesterday. But when children grow to be adolescents, it is not that easy as a child. একটা ছোট বাচ্চা, little child, crying, lamenting, hitting head on the floor, you can pick him up. But you can't do that with a 6 feet tall person. Here it reminds me one of the stories that has been addressed by Mr. Debashish Paul in his book. I have autism and I play back tennis, where it is mentioned about a teacher who made his son go through a heartbreak. I'll tell that story someday else if you haven't read it. It is such an eye-opener. And this same thing today I had to tell him that, someday maybe we'll talk, and I am thinking that maybe I will send him mails on his behalf to him and gradually wean him from there, because at times we cannot do so. We have read stories of O. Henry and people that, sometimes deceased persons, and someone takes the role of that deceased person and helps the person go through that trauma of believing that that person is there somewhere. Sometimes our people, I'm not giving this as the only solution, but if you see, because this morning my son, we could not even take him up from the bed. He was so rigid with his limbs totally fixed. He was almost in a state of catatonic depression. His limbs won't move. He won't open his eyes. He won't sit up. He won't eat. He was so utterly depressed and sad. He was bereaving. And I know many of you would say, oh, bereavement takes time. Let's go make them go through this cycle. I'm not a technical person in this. I'm a physician. I'm a mother. And I work with so many children. And it's not that I lie to my child ever. I try to tell him the truth as much as possible. But at certain times, we need to make him believe that this world is a good place. This man is good. Maybe there are certain things which is not allowing him to connect with you. But merely saying that doesn't help a person with autism. You have to give him a finite answer. You can say, Nishchoy kono oshubidha ache. It must be in some sort of a problem for which he is not connecting to you. That becomes very difficult for him to understand. He wants to see something even in his imagination which is finite. Okay. He's busy. He's working at this place. He's sending an email to me. Okay, it's fine. Even if I tell him that he'll send you emails throughout life, maybe he'll send you emails at intervals of 6 months, it's okay for him. And finally someone takes the place of this other person. This happened to so many of us, right? So Nilanjana Ghosh writes, we feel the same even at this age when someone who is so dear to me suddenly avoid us, block us. Yes. I used to feel with so many of my infatuations over television serials. I had a big infatuation for Rajit Kapoor as Byomkesh Bakshi until the time I saw his movie in Chora Chor where he was playing the role of a bird catcher. Because then I realized the same person as a bird catcher, I don't like that image. But the same person with the image of Byomkesh, I love him a lot. The same feelings happened to adolescents. Now, who are watching it as parents of mild autistic children below the age of 10, you might think, oh, ota onek ashte deri. Let me tell you that beware of the mental health issues. Because the moment your child starts doing a lot of things, understanding a lot of things, picking up a lot of skills, you think, I can overload and overburden my child with a lot of, skills or education, academics, etc. Try to understand the child's mind. Even I am having a hard time doing that. And my reason for doing today's Facebook Live was by appeal to the society, never make false promises. Number 2, please don't undermine or underestimate parents, professionals, my request to you. Number 3, if a parent is saying this works with my child, it works with the child. Give that space to the person unless you visibly see this is affecting the child. Yes, ma emon pamper korche je bachchar oshubidha hocche, then talk to the parent. Never blame the parent in front of the child. That hurts the child as well. And try to become the bridge between the child and the community, be it his friends, teachers, therapists. No matter to what extent, you have to keep on talking. I am a rebel mother. Yes, I am a rebel mother. We all are. When it comes to our child, we are lioness. Do not dare hurt my child. Do not dare hurt my child in whatsoever way. Don't do that. If you cannot love my child, don't love my child, but don't hurt him. Same thing goes for any other mother. Ritika, you say, can't imagine the pain he has gone through. Yes. And here this the mother of someone, a very bright child who can do multiple level multiplications without being able to explain it verbally. What would you say? What would you say about this about the child? She never says my child is mildly autistic because she cannot say that, because the child is verbally compromised. But I would say this child is really mildly autistic with huge frustration and anxiety issues. So thank you very much for your time. I took a lot of time. I will come back again. If you want to share your views, you can come with me on the same board, same platform, discuss. With the reason I did it on Facebook Live is because it stays recorded over here. And if you want to make this society inclusive, you want to include us, give us some love, which does not have much expectations. Give us some understanding, give us some empathy. Don't try to judge us that this parent is not doing it correctly. Every parent is doing the best of his or her abilities. Unless there are some exceptions, which exceptions prove the rule, who forget their children forever. Here you are writing that there is so much into it, and thankfully my daughter was able to control herself gradually. Yes, that happens with little kids, and that is also very sad. But let me tell you something, don't even think that she has outgrown it. Keep talking to her about other good things, and it goes away faster in little kids. The same way it happens in typicals also. Think about our age. Think about Moitreyi Devi's Nohonnate. Think about the feeling, the heartbreaks, the depression, and think about the lines Kavi Guru Rabindranath Thakur wrote to Moitreyi Devi. She said, Je boyeshta কৈশোরের যে বয়সটা ঘাতে প্রতিঘাতে, আমার কারেক্ট শব্দটা মনে নেই, আমার অন্তরটা ভেঙে যেত, তুমি তার মধ্যে দিয়ে যাচ্ছ এখন. Because when she wrote about her bereavement with Mircha to him, how she felt while she was sailing on that boat with her family, every moment she felt, I want to fall into this water. That is how they feel. Everyone feels, be it autistic, non-autistic. Please be understanding. Shuchishmita Di, if you think you can share, people can hear and understand. There is no instruction about it, nothing judgmental about it, nothing final about it. If you have your views, please share. But my point is, please try to understand an autistic adult, an autistic adolescent. Do not think mild autism. It is not as mild as you think. And then again, I see some major problems coming to me with the word of, একটু মাইল্ড আছে, একটু মাইল্ড বলে কিছু হয় না, সমস্যাটা সমস্যাই হয়। আর সেই সমস্যাটাকে জুঝার জন্য আমাদেরও খুব মাইল্ডলি চললে চলবে না। We are not mild. We are strong when it is needed. Yes, Nilanjana, you are saying it's extremely relevant Facebook Live. Thank you so much. And thanks to all of you for listening. নমস্কার, ভালো থাকবেন। আমাদের ছেলে মেয়েরা ডেফিনেটলি ওদের জায়গা এই পৃথিবীতে পাবে। They will make their place in this world. We will bring them the place in this world. And nobody has the right to hurt them. Till the time we are here, even after we are no more here, nobody has the right to hurt them. Thank you so much. Bye. Good night.